Welcome. This is a short movie summarizing the various presentations I've delivered recently on molecular image guided radiation therapy, MIGRT in short. MIGRT has been a pet concept for several years at my end. It got fructified more recently with the development of this prototype and validating it. We earlier presented this at the Gordon Conference, Drug Carriers in Medicine and Health, and later a talk at ASTRO, the 56th annual meeting, San Francisco, USA. Recently, at the World Molecular Imaging Congress at Seoul, Korea. There's an unprecedented convergence of molecular imaging in radiation therapy. It's well known. However, in preclinical setup, we still have to emulate the same changes what we see in clinics so as to get a better development, better handle on delivering good radiation pharma, radioprotection, radioprotectants, sensitizers, and countermeasures. Also, bring out better radiation strategies for future personalized radiation therapy and care. The schematic here is the multimodal molecular imaging system which we have incorporated directly into the steel-lined X-ray radiation chambers or cabinets. The upper end constitutes the therapeutic business end, and the bottom end is the diagnostic, which is the multimodal unit, bringing out the diagnostic approach. The movie of the prototype is shown here. As you can see, the subject is now on XY stage, where once the tissue or the diseased part is localized using the molecular approaches, can be subjected to radiation, X-ray irradiation treatment using the collimated beam. Beneath the subject is a phosphor screen which allows the anatomical imaging as well as the molecular imaging simultaneously using the CCD, highly sensitive CCD camera. The X-ray tube has two focal spots, the smaller focal size, good enough for imaging, the larger focal spot for therapy. The multimodal imaging system allows the molecular analysis of the preclinical subject, be it as cellular or small animal, as small as mouse to large animal as rabbit, to be analyzed prior to radiation treatment, during the radiation treatment, or post-irradiation. Thus, the diagnostic approach provides opportunities to get better strategies, better understanding of various molecular mechanisms, both in physiological and pathophysiological conditions in cancer. Again, once we can image, then localize and avail therapy using this prototype MIGRT, which is molecular image guided radiation therapy. Examples are shown here, some of the projects which is ongoing in my lab. In the upper end, you can see the glioblastoma, the brain tumor, which expresses where there is engineered bioluminescent cells or cancerous cells which express luciferase, can be visualized using this multimodal imaging system, where one can actually detect the luminescence, overlay that on the anatomical backdrop using the X-ray, low energy X-ray, to get its localization. And beneath you can see the nanoradioguidance, where nanoparticles which elicit luminescence upon irradiation, 100 kV irradiation, can localize the tissue of interest. And this again is a movie where you can see the XY stage moving the animal to site of interest where you can irradiate. And the red dot denotes the collimated beam. A different project we show is radiation injury studies ongoing together with my lab as well as Shahid Umar at Kansas University. We show that at a particular whole body irradiation, you can use probes, chemical probes, to determine the reactive oxygen species or ROS activity generated upon GI injury. These studies have led us to detect changes in the microbiota at very early stage, especially the changes in Clostridium and butyrate producing Clostridium. And later there's a distinct changes in stem cells in the crypt length because of the GI injury. Thus this MIGRT provides valuable opportunities to address various physiological questions arising in better treatment plans future. A good example here is a lung fibrosis model studies which is ongoing at Dr. Lata Paka's lab, and we show that the presence of this phosphor imaging, that is phosphor screen, providing anatomical details, allows us to now localize a focal radiation treatment of the lung in their studies of lung fibrosis to obtain or to evaluate their drug for protection of lung fibrosis. Again, the movie is shown to show how this prototype works. Once localized, once the molecular signatures, be it luminescence, or fluorescence, or near infrared fluorescence, or X-ray guided, that is doped nanoparticles, can be utilized where target them to a site of interest. These nanoparticles or elicit luminescence upon irradiation, and also these nanoparticles by themselves can be diagnostics to provide X-ray induced photoelectric effect. Thus this diagnostic module be quite useful in labs like ours, as well as in labs where countermeasures, radioprotectants, and other medical radiation pharma are designed and evaluated for discovery. Thank you.